If someone you love is in their final year of life, there's often no dramatic moment that tells you so. No collapse, no single frightening diagnosis, no doctor sitting you down with the news. Instead, there are quiet changes in appetite, in sleep, in how much they want to talk to you that families miss for months because each one, on its own, looks like just getting older. I'm Dr. James Carter, and after more than 2 decades working with older adults and their families, I want to walk you through the 5 changes that, together, tend to matter most. I'm not here to frighten you, and I'm not here to give you a countdown clock. I'm here to help you recognize what your body, or your parent's body, or your spouse's may already be quietly telling you so you can respond with care instead of confusion. Before I go further, I want to say clearly, nothing in this video is a diagnosis, and none of it replaces a conversation with your loved one's actual physician, or, ideally, a palliative care or hospice team, who are trained specifically to assess where someone is in this process. What I can offer is the pattern recognition that comes from having sat with many families through this exact stretch of time, the signs that, when several appear together and persist, are worth bringing directly to a doctor rather than quietly explaining away. I also want to ask you something before we go further, because I read every comment on this channel. Tell me where you're coming into this video from. Are you watching because of changes you're noticing in yourself, or in someone you love? And how old is that person? I ask because it genuinely shapes how I think about future videos on this topic, and because I think it helps other people in the comments to know they're not the only ones sitting with this question tonight. Let's go through the 5 signs. I'm going to move from the ones that are easier to miss to the ones that tend to be the clearest. The first sign is a real, sustained decline in appetite and interest in food, one that isn't explained by a stomach bug, a new medication, or a dental problem. I think of Walter, 83, from a small town in Iowa, whose daughter mentioned almost in passing that he'd just gone off food over the past few months. He wasn't in pain. Nothing tasted wrong to him. He simply wasn't hungry, and portions that used to disappear in one sitting were coming back half-finished, then barely touched. His daughter had chalked it up to him living alone and not bothering to cook properly, and, for a while, that explanation made sense. Here's why this particular change matters more than families often realize. Appetite is regulated by a complex set of signals between your gut, your hormones, and your brain. And as the body's systems begin to slow down in a genuinely serious, sustained way, not from a passing illness, but from the body's overall decline. One of the earliest things to change is the drive to eat. Think of it like a factory gradually reducing its shifts. The workers aren't ordering the usual amount of raw material anymore because the production line itself is slowing down. A body that is beginning to wind down often simply doesn't need and doesn't want the fuel it once did. This is different from a temporary appetite dip due to a cold, a new medication, or grief, all of which usually resolve within days to a couple of weeks. What matters here is persistence, a decline in eating and drinking that continues for several weeks or months, with gradual weight loss and no clear reversible cause that a doctor's been able to identify. What I'd encourage you to do, practically, is not to force feeding or turn every meal into a battle, which tends to create distress for everyone involved without changing the underlying picture. Instead, offer small amounts of whatever appeals to them, whenever it appeals to them, and bring this pattern specifically to their doctor, not as they're not eating much, which gets easily dismissed, but as this has been going on for X weeks or months. Here's the weight change we've measured, and here's what we've already ruled out. That specificity helps a physician take the concern seriously and evaluate it properly. The second sign is a marked increase in sleep, combined with a pulling away from conversations, visits, and activities they used to look forward to. Eleanor, 79, from a suburb outside Sacramento, had always been the one calling her friends to organize their weekly lunch. Over a period of about 4 months, her daughter noticed she'd started sleeping through much of the afternoon, and when friends called to check in, she'd often ask to talk another time. It wasn't depression in the way her family first assumed, and antidepressants her doctor cautiously tried didn't change the pattern. It was something more fundamental happening in her body. Here's what's typically going on physiologically. As the body's overall energy systems decline, including the efficiency of mitochondria, the tiny structures inside your cells that produce usable energy, think of them as the power generators inside a factory. There is often less energy available for the brain to sustain the alertness and social engagement it once did easily. Sleep increases partly because the body is, in a real sense, redirecting whatever energy it has toward more basic functions, and partly because a natural withdrawal from the wider world is a pattern many hospice and palliative care clinicians observe repeatedly in the final months of life, sometimes described as a gradual turning inward. This is different from ordinary tiredness or a single bad week. What matters here is the trajectory, a steady, sustained increase in time spent sleeping, alongside a genuine loss of interest in people and activities that used to bring real pleasure, sustained over weeks rather than days. Practically, I would encourage families not to interpret this withdrawal as rejection, and not to constantly push the person to snap out of it, or attend gatherings they no longer have the energy or desire for. Respecting their reduced capacity, while still checking in gently and consistently, tends to matter more than trying to reverse the pattern. And, as with appetite, bring the specific trajectory to their physician. How long has this been happening? How much has sleep increased, and what has been ruled out? The third sign is a real decline in mobility and physical function, not just being a little slower, but a noticeable drop in the ability to do things they were managing independently only recently. Vincent, 76, from outside Phoenix, had been walking to his mailbox and back every single day for years. Over the course of a single season, his son noticed he'd stopped making that walk, then stopped getting up from his recliner without help, then needed assistance simply getting to the bathroom. A decline that felt sudden to the family even though, looking back, the early signs had been present for months. Here's the underlying reason this particular sign carries real weight. Sustained functional decline, meaning the loss of the ability to perform basic daily activities like walking, transferring from a bed to a chair, or managing personal care reflects a body-wide process, not an isolated joint or muscle problem. Muscle tissue is normally maintained through an ongoing cycle of breakdown and rebuilding, but in a body that is seriously and progressively declining, that rebuilding process essentially stops responding, similar to a delivery truck arriving at a construction site that has already stopped construction altogether. The materials show up, but there's no more building happening to use them. This is a meaningfully different picture from the gradual muscle loss of ordinary aging, which tends to be slow and relatively stable. What matters here is a clear, continuing downward trajectory over weeks to months, not a plateau. Practically, this is a sign that calls for direct medical involvement rather than home workarounds alone. A physician, ideally alongside a physical therapist or occupational therapist, can help distinguish between a reversible cause of decline, like an infection, dehydration, or a medication side effect, and a decline that reflects the body's broader trajectory. Bringing in home safety equipment, additional caregiving support, and a clear conversation with the medical team about what's driving the change all matter more at this stage than trying to push through it with exercise alone. Before I move into the final two signs which I think matter most, I want to pause for a moment. If this video is helping you understand what you're watching in someone you love or in yourself, please consider subscribing to this channel, because I cover both the medical and the emotional side of aging honestly here, and it helps this information reach other families who are quietly asking the same questions you might be asking tonight. Now let's continue. The fourth sign is a noticeable change in circulation and breathing cooler hands and feet, a bluish or mottled tint to the skin, and breathing that becomes irregular, particularly during sleep. Dorothy, 81, from outside Portland, Oregon, had always run warm, according to her husband of over 50 years. In her final months, he noticed her hands and feet were cold nearly all the time, even under blankets, and her skin along her lower legs had developed a mottled, almost lace-like pattern he'd never seen before. Her breathing at night had also changed, sometimes very shallow, occasionally pausing for several seconds before resuming. Here's what's happening physiologically, explained as simply as I can put it. As the body's circulatory system begins to prioritize blood flow to the most essential organs, the heart, the brain, the lungs, blood flow to the extremities, the hands and feet, is often reduced, leading to the coolness and skin discoloration families frequently notice. This is your circulatory system behaving like a city experiencing a power shortage, redirecting available electricity to hospitals and emergency services first, while outlying neighborhoods receive less. Similarly, changes in breathing pattern, including irregular pauses, often reflect changes in how the brainstem is regulating this most basic, usually automatic function as the body's overall systems become less stable. These particular signs, especially when they appear together and persist, are generally considered by hospice and palliative care clinicians to reflect a more advanced stage of decline than the earlier signs on this list. This is not something to manage alone at home through guesswork. If you notice this pattern in someone you love, I would strongly encourage a direct conversation with their physician about their overall prognosis, and specifically about whether a palliative care or hospice evaluation would be appropriate, since these teams are specifically trained to assess this stage and to help keep the person comfortable. And now the fifth sign, the one I believe families most often overlook or most often struggle to talk about openly, and yet in my experience, it is frequently the clearest signal of all. The fifth sign is a shift in emotional or spiritual outlook, a sense of peace, of finishing unfinished business, of wanting to see specific people or say specific things, sometimes even talking about people who have already died as though preparing for a reunion. Ruth, 78, from a small coastal town in Oregon, spent an afternoon with her daughter going through old photographs, something she'd resisted doing for years. She asked her daughter to promise to look after a specific piece of jewelry, mentioned her late husband more than she had in a long while, and told her daughter, quite calmly, that she felt ready whenever it happens. Her daughter told me this conversation felt different from anything that came before it, and she was right to notice that. This kind of shift is widely described by hospice workers and palliative care clinicians who spend significant time with people in their final months, and while it is harder to explain through pure physiology than the other signs on this list, it appears to reflect something real about how people process the approach of the end of life, often with more clarity and calm than families expect, and often well before the physical signs become obvious. It is not something to fear or to redirect quickly with reassurance that you're going to be fine. In my experience, and in the experience of hospice professionals I've worked alongside for years, this is frequently a moment that calls for presence rather than correction sitting with the conversation, allowing the person to say what they need to say, asking what matters most to them right now, rather than steering the conversation away from a topic that clearly needs to be spoken aloud. Practically, if you notice this shift in someone you love, I'd encourage you to lean into it rather than away from it. Ask if there's anyone they'd like to see, anything they'd like to say to specific people, anything left undone that matters to them. These conversations are difficult, but they are very often described by families afterward as some of the most meaningful conversations they ever had with that person, precisely because they happened honestly, rather than being avoided. I want to be honest with you about something important before I close. Any one of these 5 signs, on its own, can have a far simpler explanation, a medication side effect, an infection, a passing depression, ordinary grief, ordinary aging. What tends to matter is the combination of several of these signs together, and the sustained trajectory over weeks and months, rather than any single afternoon or any single symptom. This is exactly why involving a physician, and ideally a palliative care or hospice team, matters so much they are trained specifically to weigh these signs together and to help you understand where your loved one truly is in this process, rather than leaving you to interpret it alone from the outside. I want to close with something that I hope stays with you. Recognizing these signs isn't about giving up on someone, and it isn't about resigning yourself to a fixed timeline. It's about being present enough and honest enough to meet this stage of life with the same care and attention you'd want for yourself. Quality of life doesn't disappear in someone's final months, it changes shape, and it can still include real comfort, real connection, and real moments of peace, especially when the people around them understand what's happening and respond with patience rather than panic. Walter, Eleanor, Vincent, Dorothy, and Ruth, and their families, all found their way through this stage not by predicting exactly how much time remained, but by paying close attention, asking for help from the right people, and staying present for whatever time was left. If you are watching this because you're worried about someone you love, please don't carry that worry alone. Reach out to their doctor. Ask specifically about a palliative care or hospice evaluation, and let trained professionals help guide you and your family through what comes next. If this video helped you understand something you've been quietly noticing, please subscribe to this channel because I try to cover these harder, more honest conversations about aging alongside the more everyday health topics. And if you're comfortable sharing, I'd like to know in the comments gently, is there a sign on this list that you recognized, and how are you and your family doing with it right now? I read every comment, and I'll see you in the next video.